Hello, good morning, dear colleagues and respected seniors. Thank you for giving me the opportunity to present the presentation today. My name is Dr. Fayaz Ali and I'm a resident of urology at SIUT. Today I'm here to discuss one of the crucial topics in modern urology, that is the use of energy modalities in urology. And through this presentation, I'll be discussing the various types of energies used, their applications, and their overall impact on the outcome of patients. And I'll also like to thank Dr. Mavish for helping in making this presentation and being here for and playing the role of moderator in today's session. So the energy modalities have been used in urology since many years, and a lot of different surgical steps like tissue dissection and cauterization, lithotripsy, and tumor ablation have evolved through time when we talk about the energy modalities. So they have evolved through the time and various with the use of various energy modalities. So we'll be discussing the tissue dissection and cauterization and lithotripsy with respect of urology today. Speaking about the tissue dissection and cauterization, electrosurgery plays a cornerstone in the history, as it was the first procedure that evolved this whole mechanism. So basically, the electrosurgery is the application of electric current for the use of cutting, coagulation, desiccation, and fulguration. And it was in use since 1800s, but the actual breakthrough came when Dr. William T. Bovey first made a cutting loop device in 1920s for the purpose of cutting, coagulation, desiccation, and fulguration. Electrosurgery is different from electrocautery because in electrocautery, the current is used to heat up the handheld instrument, and then that instrument is applied to the tissues. While in electrosurgery, the actual current passes through the tissue. So let's see what are the key components of electrosurgery. The one is the generator and the electrodes. These are the key components. The generator actually converts the normal 50 to 60 hertz current that is coming from a normal power supply, and it converts it into a high frequency current that is 3000 to 4 megahertz, 3000 kilohertz to 4 megahertz. And basically the idea is that this high frequency current minimizes neuromuscular stimulation and ensures that the energy focuses on the tissue rather than causing any unintended contractions. Then we have the electrodes. There are two primary electrodes used. The first is active electrode or a cutting electrode, which is used to apply the energy directly to the tissue. And then there is the passive electrode, which returns the current back to the electrosurgical generator. So let's see how this mechanism works. Basically, when the generator is connected to a power supply, it converts it into a high frequency current and supplies it to the active electrode. The active electrode then converts that or applies that current to the tissue. And then while passing through the tissue, then the current is returned to the electrode via the return electrode. So the electrosurgery can be, electrosurgery is divided into two, like monopolar electrosurgery and bipolar. So this mechanism, as we already saw, that this mechanism, that the generator is connected and then it passes the current to the active electrode. And in monopolar surgery, the idea is basically that the current is the high frequency current is supplied to the tip of the working instrument, which produces the desired effects. And all the current is concentrated at the tip of the working instrument. And then it disperses throughout the body and then returns through via the passive electrode, that is a grounding pad in this mechanism. And then it returns back to the passive electrode. Basically, इसमें होता है कि जो high frequency current है वो पूरा जो है वो tip पे ही जो है वो focus होना चाहिए. और अगर if the current is led to be concentrated anywhere else in the body, then it will also cause some morbid effects elsewhere as well. So इसमें इसलिए जो ग्राउंडिंग पैड की भी जो बेसिकली जो फिजिक्स है उसमें ये है कि ग्राउंडिंग पैड को जो है ना उसका सरफेस एरिया ज्यादा रखा जाता है और उसमें या तो कोई फ्लूइड या जेल यूज की जाती है ताकि जो है वो करंट वहां पे भी कंसंट्रेट ना हो. तो इसमें हम आगे जाके देखेंगे कि सेफ्टी में ये होता है कि अगर इसमें कोई ग्राउंडिंग पैड में भी कोई मसला आ जाता है कि अगर उसमें जो है दैट इज नॉट फोकस्ड, वो अगर सही से प्लेस नहीं किया गया या उसमें कोई टीयर या वो हो गया, so the current get focused at the grounding pad side, and then the current basically causes morbid effect at the site of grounding pad as well. So the monopolar current can be used for the two effects to measure. Otherwise, there is also blending and fulguration as well. But the cutting and coagulation are the two main effects that are achieved in monopolar electrosurgery. The cutting current produces clean incisions with minimal tissue destruction. as cells are rapidly heated and ruptured. While in coagulation, it results in drying and charring of the tissue, leading to a more widespread damage area as it seeds blood vessels to stop bleeding. So as we can see in the graph below, that there is in the cutting current, it uses continuous current, delivering uninterrupted radio frequency energy. And because it is continuous, so it rapidly heats the tissue and causes the cells to rupture, hence causing the cutting. While in coagulation, the current is interrupted, and the burst of energies allow the tissue to cool between the pulses and drying out the cells rather than rupturing them. So it causes the coagulation effect. And cutting can be operated at lower voltages and enough to heat and slice through the tissue with excessive collateral damage. While in coagulation current, we need higher voltages to effectively clot blood and stop bleeding, which can cause deeper tissue damage and charring.
Ek minute. So based on this, which current is more destructive to the tissues, either cutting or coagulation? Why?
Because it has a higher voltage and it goes deeper to the tissues, and it causes the tissue charring, basically, not rupturing of the cells.
Yes, quite deep-seated charring of the tissues has been produced, and therefore we do not use coagulation current for opening up the tissues. Whenever we are opening the fat and everything, when the tissues are not clear to us, we don't use coagulation current. We use cutting current for that. And once the boundaries are clear, we use coagulation current after that. Okay.
So as I mentioned, that monopolar is more destructive than bipolar because the current is passing through the body. So there are various safety protocols and precautionary measures that should be taken while using the monopolar electrosurgery. So the general safety measures are that they use lowest effective settings should be used, and the electrode tips should be properly cleaned every time, and touching the patient with free hand should be avoided while doing the surgery. इसमें ये था कि वन मोस्ट कॉमन step or इसमें ये होता है कि normally a surgeon holds some tissue with the forceps and then ask the assistant to apply the monopolar over that instrument. And especially at that time, it is important that the surgeon should not place his hand or the other hand, which is free, on the body, because then the current can also transfer through that current and cause a deleterious effect. And the cord should be kept untangled and placed in insulator holsters, because कोई भी अगर उसमें कोई cord में कोई कहाँ पे भी जो है ना वो कोई cut है तो वो that can cause the current to travel through that. Grounding pad safety is very important in monopolar electrosurgery because उसमें ये है कि it should be kept clean, dry and free from debris, and it should be checked if it is working properly and there is no any damage or wear in the grounding pad.
Basically, initially the grounding pads were of metallic nature, and there a gel used to be placed, and then the conduction of the current used to take place from that. But from there, the basic problem was the gel, whenever it used to get evaporated or get less during some long procedures or long surgeries, the cutting current that passed through that grounding pad used to damage the tissues from there. But now the grounding pads have been changed. They are basically more of that sticking pads what you used to see. And now we don't use any form of gels or something like that. And the machines today are basically inbuilt for detecting any current that is leaking. So if the grounding part is not placed properly in today's machines, you do not have any current flowing. The system will give you an error that this machine is not working properly. Just check the instruments. So now this error is basically been reduced because of the new machineries, but you can see these errors in the older ones still. So you have to ensure the grounding pad is placed properly in the proper position. Otherwise, you'll see, even today, we see injuries from the current from the grounding pad areas. Okay.
Considering tissue impedance is very important because various different tissues have different ability to conduct electricity. Like blood vessels, they have low impedance and concentrate current, while the fat resists it. So surgeons should also consider tissue impedance, especially when dealing with delicate structures like the bowel.
So what would happen if the bowel is being cauterized on anything and you do not consider this thing? Impedance effect. Any idea? If we are coagulating on the surface of the bowel or anything and we have coagulated, do we have any injuries that could occur in the bowel? What? Basically, the impedance का basic जो function होता है वही होता है, the current basically flows the pathway of the lowest resistance, right? So whenever you are burning on anything like bowel or anything, you're coagulating in that area. So that would be following the path of the lowest resistance, and that would be the blood vessels present there. Since the bowel is very sensitive to the supply, it would travel preferably through its vessels through the mesentery, and it would basically coagulate or damage its vessel. And as a result of which the bowel can damage because of its vessels getting damaged. So whenever working in front near to the bowel segments, you'll have to be very careful that whatever you're burning, whatever you coagulating, just see the vascular areas around that, because that would be current would be following the pathway of the lowest impedance. That would be the blood vessels.
Pacemakers and prosthetics should also be considered before going for a surgery, because pacemakers, because they also use electrical energy. So the manufacturer should be consulted before the surgery to ask whether the frequencies match or something like that. So the manufacturer, the surgeon should know if the pacemaker is there and that the specific monopolar device that is being used, if its frequency matches with it, then it will also cause a disturbance. And then there is the prosthetic joints. If the prosthetic joints are in the body, we should place the grounding pad on the opposite side to ensure that the safe current flow and the current should not travel to the prosthetic joint.
What do we actually do for pacemakers? If a person has pacemaker, what do we do?
We usually use bipolar energy, or we can call the cardiology team to match the frequencies of both the pacemakers and the monopolar.
So what does bipolar does? Why do we use bipolar?
Bipolar is basically there are two poles between which the current flows, not through the body of the patient.
So therefore, it won't be affecting the pacemaker. The current won't be passing through the area of the pacemaker.
Yes.
Okay.
Then there is a concept of capacitive coupling, in which the electric energy transfers between the two conductive materials. It is most common in laparoscopic surgeries, because in which we use the devices, trocars and trocars, etc. So the risk during the laparoscopic surgery, especially when insulated electrodes and metal plastic trocars are used, so the current can pass through the insulated material as well, and then cause the damage to the internal organs. So active monitoring and using lower voltage settings is crucial, in especially in when using monopolar surgery, monopolar electrosurgery in laparoscopic surgeries. Then we come to the bipolar electrosurgery, as we discussed that it is safer, because the current, you can see in the image that the current passes and passes through the device and comes back through that particular through the same device, through the same handpiece. So it does not pass through the body in bipolar surgery. And as we focus on this device, that active and return electrode both are in the handpiece. So the current passes only, so the tissue that is only between these two limbs of that handpiece, the current only passes through that particular tissue. And the current flow is confined to the tissue, and the vessel sealing properties is also good with the bipolar surgery. It can also it can seal vessels up to 7 millimeter. And LigaSure is a more advanced device. It also uses the concept of bipolar electrosurgery, but it also applies it has a pressure effect as well. So it also applies the pressure and has a feedback mechanism. When the vessel is coagulated, it gives you sort of sort of ring बजती है, जिससे पता चलता है कि जो है ना वो vessel seal हो गई है. So these are LigaSure, and this is a comparison between a LigaSure and a harmonic scalpel, in which you can see that LigaSure demonstrates better functional outcomes over harmonic scalpel, especially in, for example, in continence erectile function in a laparoscopic radical prostatectomy. While harmonic has an advantage because it reduces the thermal spread and smoke production. Then comes the laser instrumentation. The laser has redefined the modern surgery because of its precision and elegance, and all these techniques which we discussed, cutting, coagulation, lithotripsy, and all these have now the laser has taken over and providing us better results than other other modalities. So in this presentation, we'll discuss the basic physics of laser, which can be better explained by the abbreviation as well. That is a light amplification by stimulated emission of electromagnetic radiation. In urology, it was first used in 1980s, And now they have evolved to treat a wide range of soft tissue conditions and urinary stones. The holmium laser is the gold standard, as we all know, for urinary stones. And other wavelengths are also used for soft tissue conditions like benign prostate hyperplasia, strictures, and urethral cancers as well. So let's see how the laser is different from the normal light. What is the difference? So as you can see that in ordinary light, the light is scattered, and it is the waves are scattered. They are polychromatic. They are incoherent and diffuse. So the energy is not concentrated to any specific point. While in laser, the radiation is focused monochromatic and coherent and intense. So all the energy gets focused on a specific area and then causes the desired effect. So let's see. Let's understand the mechanism of a laser machine or a laser device. Basically, there is an active medium that is placed. That is a core component of this device. The active medium can use argon or holmium, as we know, and neodymium, all these carbon dioxide. So what happens कि जब energy source apply की जाती है उस active medium पे या उस material पे, वो material solid भी हो सकता है, gas भी हो सकती है, liquid भी हो सकता है. तो उस मटेरियल पे जब होता है तो उसके जो इलेक्ट्रॉन्स होते हैं वो दे जंप इनटू देन एक्साइटेड और हाई एनर्जी लेवल्स, और फिर वो जब वापस आते हैं तो दे रिलीज अ फोटोन, एंड देन दीज फोटोन्स देन कॉज द अदर एटम्स और कॉज द एक्साइटेशन ऑफ अदर एटम्स. फिर उसमें ये होता है कि एक चेन रिएक्शन डेवलप हो जाता है जिससे जो है बहुत सारे फोटोन्स क्रिएट हो जाते हैं, एंड देन देयर इज अ रेजोनेंट कैविटी जिसमें ये होता है कि अब वो जो फोटोन्स जो कि ऑलरेडी उसमें हैं तो वो रेजोनेंट कैविटी में क्या होता है कि एक मिरर होते हैं दो साइड पे, एक रिफ्लेक्टिव होता है जो हाफ रिफ्लेक्शन होती है उसमें, तो दे बाउंस बैक एंड फोर्थ थ्रू दैट मिरर एंड देन कम आउट फ्रॉम इन अ लीनियर मैनर. तो वो सारे वहां से जो है ना वो एक तो ये हो जाए कि एम्पलीफाई हो गया, तो एज वी से द लाइट एम्पलीफिकेशन, और फिर वो सारे जो है वो कोहेरेंट होके एक ही ओपनिंग से जब रिलीज होते हैं तो इट कॉजेज इट मेक्स अ लेजर.
Can anyone else explain this procedure?
The site of less resistance, and when that electron completes its circuit, it causes the release of a photon, and that photon causes the excitation of another atom, and then the electron from that atom travels through the circuit, and when it completes the circuit, this is how it causes the excitation of the second atom, and this is how the chain reaction goes on. And when the multiple photons get collected in that cavity, they then get transmitted through their to their target.
Basically, yes, you're right. Basically, laser is basically stimulated emission of the photons. We give the stimulation and the photons are emitted. Photons are basically what we describe in as packets of energy, right? So whenever the electron jumps from a lower energy state to a higher energy state, it gains a photon. And when it comes back to its normal energy state, it would give back that photon. This photon is basically used and it's been amplified, like just Fayaz said, in a tube that basically resonate back and forwards because of the reflection, because of the reflective mirrors. And when they're basically being amplified, then they basically being conducted through a small hole in a specific area. So that would be basically an amplified light, and that would be basically a high energy system that would be delivered to the area where you desire. So this is
simply could be understood by the mechanism of the sunlight, how the sunlight is reflected over the particles and then gives the light to the the whole environment. So this is how it works as well. The only difference is the coherence and the incoherence. Since there is a resonant cavity, it gets like accumulated in the single space, and since it's an open environment, so you can see the light dispersed all over. So this is how you can correlate the two situations.
coherence
somehow.
and monochromatic. The basic
Yes.
sunlight is not monochromatic. It has
Yes.
various
Polychromatic,
wavelengths.
yes.
It is monochromatic. It has single wavelength. All the electrons or the photons are in the similar state.
Okay, so there are different types of waves, continuous versus pulse. The continuous emit a stable, constant beam ideal for control applications, while the pulse delivers energy in burst, effective for tasks like stone fragmentation. And the continuous is, however, easier to control in soft tissues, while the pulse waves are powerful, so they may be harder to manage in these contexts.
So where do we use pulsed and where do you use continuous laser?
In stone surgeries, we use pulse wavelengths, and in I
And for
think,
other soft tissue surgeries,
soft
we use
tissues like
continuous
strictures or your
because pulsed will be basically giving energy and then stopping it. It's like more of a lithotripsy sort of effect, just giving off energy then stopping it. So it's mostly used in stones. And other than that, you usually use continuous energy.
Then the laser delivery systems, basically the lasers are needs a delivery system to be transferred to that specific object, and these systems include articulating arms and fiber optic glass fibers are used. For example, in carbon dioxide lasers, articulating arms are used since the wavelength is very longer, so they can pass through the standard fiber optic delivery systems. So now we'll understand the tissue interaction. How does the laser cause the specific effect that we want? तो उसमें जो है सबसे important absorption है. So how does it is the most crucial interaction. So basically, when the laser light is absorbed by the tissue, its energy is converted to heat, which raises the temperature of the tissue and lead to coagulation or vaporization. So for this to happen, the laser must interact with certain molecules in the tissue that are called chromophores. जिसमें water and hemoglobin is important, which are specifically relevant in urological surgeries. So in this graph, we can see that water which shows a higher absorption at longer wavelengths, such as erbium and carbon dioxide lasers, meaning these lasers have a shallow penetration in water dense tissues. मतलब अगर किसी टिश्यू का कंपोनेंट मेजर कंपोनेंट वाटर है तो उसके लिए एक स्पेसिफिक लेजर्स होंगी जो कि सिर्फ जो है वो उस टिश्यू पे ज्यादा अच्छे से जो है ना वो वर्क करेंगी. और उसमें दूसरा अगर हेमोग्लोबिन है, दैट इज आल्सो एन इंपॉर्टेंट chromophore in the body, and it shows peak in absorption between 0.5 to 1 micrometer wavelengths. और उसमें एक है नियोडीमियम है और जो है ना वो दूसरी बाकी लेजर्स हैं जो कि जो है वो हेमोग्लोबिन को जो है ना वो अपना टारगेट वो बनाती हैं और उसके थ्रू एब्जॉर्ब होती है. तो बेसिकली इसमें आइडिया ये है कि जिस टिश्यू का जो कंपोनेंट होगा उसके हिसाब से वो लेजर उस पर बेटर वर्क करेगी और लेस पेनिट्रेटिव होगी. बिकॉज अगर वो टिश्यू जो है वो उसको कंप्लीटली एब्जॉर्ब कर देता है, देन दैट लेजर विल नॉट गेट ट्रांसफर एनर्जी to any other tissue, and that will be specific to that particular tissue. Other is reflection. Some of the light may bounce off the surface and not penetrate the tissue, and can cause unintended heating or damage to nearby tissues, but it is does not depend on the laser wavelength and is influenced by the tissue surface and surrounding fluids. उसके बाद scattering also happens and can get spread out as it passes through the tissue, reducing its effectiveness at the target site. The amount of scattering depends on the laser's wavelength. Shorter wavelengths tend to scatter more than larger ones. This makes scattering an important factor when deciding which laser to use. So now we discuss the types of lasers, in which the neodymium, yttrium, aluminum, garnet, NDA जिसको कहते हैं, that is a wavelength of 100,064 nanometers. एंड टिश्यू पेनिट्रेशन इसकी जो है वो 1 सेंटीमीटर तक है, जो कि हम आगे देखेंगे कि बहुत ज्यादा है. गुड हेमोस्टैटिक एंड कोगुलेटिव प्रॉपर्टीज. एंड हिस्टोरिकली ये यूज होती थी फॉर विजुअल लेजर एब्लेशन प्रोसेस एंड इंटरस्टिशियल लेजर कोगुलेशन ऑफ द प्रोस्टेट. इसमें ये था कि जो है वो थ्रू द लेजर के साथ हम जो है ना वो एक बर्स्ट ऑफ लेजर थ्रू एक स्कोप के साथ हम बर्स्ट ऑफ लेजर जो है ना वो उससे ट्रांसफर होती थी, एंड कॉज द कोगुलेटिव नेक्रोसिस ऑफ द प्रोस्टेट टिश्यू. और फिर वो जो है टिश्यू जो है स्लव ऑफ हो जाता था विद इन वीक्स फॉलोइंग द सर्जरी. अच्छा, इसमें ड्रॉबैक ये है कि जो है वो it needs a prolonged catheterization due to post-op edema and risk of urinary retention. और जो है ना लॉन्ग टर्म ड्यूरेबिलिटी इश्यूज विद हायर ट्रीटमेंट रेट्स भी जो है ना दिस इज वन ऑफ द ड्रॉबैक ऑफ दिस लेजर. उसके बाद KTP यूज हुई, दैट वाज बेसिकली द NDA लेजर वाज देन पास थ्रू अ KTP क्रिस्टल, जिसमें जो है वो विच रिजल्ट इन डबलिंग द फ्रीक्वेंसी इन हाविंग द वेवलेंथ. तो उसे जो है स्ट्रांगली एब्जॉर्ब बाय हेमोग्लोबिन एंड इसकी पेनिट्रेशन जो है वो कम हो गई, 1 to 2 मिलीमीटर तक हो गई. एंड इट वाज यूज्ड फॉर दिस स्पेसिफिक प्रोसीजर कॉल्ड फोटो सिलेक्टिव वेपराइजेशन ऑफ द प्रोस्टेट. उसका मैकेनिज्म ये था कि दिस because prostate is a well viscosized tissue and it has a good absorption, this specific laser has a good absorption of hemoglobin, so is it treated in a non contrast fashion with a side firing laser fiber के साथ जो है ना वो फायर की जाती थी. The targeted tissue increase in temperature above the boiling point and is vaporized, leaves behind a rim of coagulative tissue that provides a layer of hemostasis. उसके लिए जो है ना इट हैड अ गुड लिमिटेड डेप्थ ऑफ टिश्यू पेनिट्रेशन, जिसमें जैसे कि हमने NDA में देखा कि इट वाज गेटिंग पेनिट्रेट फॉर 1 सेंटीमीटर, जबकि ये जो है इसकी टिश्यू पेनिट्रेशन सिर्फ 1 to 2 मिलीमीटर थी. सो इट इज अ लिमिटेड डेप्थ ऑफ टिश्यू पेनिट्रेशन कंपेयर टू VLAP. लेस टिश्यू एडिमा उसकी वजह से एडिमा भी नहीं होता था, एंड प्रोलॉन्ग कैथेटराइजेशन वाज नॉट रिक्वायर्ड. Then came the most famous holmium YEG, जिसकी जो है वेवलेंथ बहुत ज्यादा है, 2140 नैनोमीटर, बहुत कम 2140 नैनोमीटर, उसकी टिश्यू पेनिट्रेशन 0.5 millimeter in fluid medium. That is very good, and specifically in prostate it is 0.4. Allows for precise tissue vaporization and coagulation, especially useful for hemostasis in small blood vessels. And the most famous holmium laser enucleation of the prostate is this process. This procedure was done by the holmium YEG laser. इसका mechanism ये है कि the laser enucleates the prostate lobes and pushes them into the bladder for removal. And then the onset of vaporization occurs in the irrigant that is adjacent to the tip of the laser fiber with each pulse of the laser. And a steam bubble of a few millimeters in diameter is created with each pulse. Steam bubbles help separate the prostatic tissue, resulting in a smooth, fibrous, white fibrous appearance. This steam bubble mechanism, we'll also see the video of it later in the lithotripsy as well. Its good points were that it can treat large glands over 100 grams and shows a substantial improvement in Qmax post-operatively. Results in shorter catheterization and hospital stays, and has a low rate of treatment. The drawbacks were that the risk of musculator-related bladder injury was high, and perforation of the prostate capsule could occur. It was only 9.6%, and transient urinary incontinence could occur after this, and urethral strictures, and the risk of urethral strictures and retrograde ejaculation was also high in these procedures. Now we'll discuss the intracorporeal lithotripsy, in which basically various energies are used for intracorporeal lithotripsy. There is electrohydraulic, pneumatic lithotripsy, ultrasonic lithotripsy, laser lithotripsy, and combined techniques are there. In this, we will discuss only pneumatic and laser today. So pneumatic lithotripsy is a versatile and reliable treatment for urolithiasis across the genitourinary tract with 95% success rate. Effective for fragmenting hard stones, and it is less efficient for soft stones. The mechanism is that basically it uses a ballistic force to transfer the kinetic energy to stones, and driven by compressed gas or electromagnetic oscillations. It acts like a jackhammer, effective on rigid stone, but soft tissues also absorb the impact. It is durable, simple, and reusable, and fragments all stone compositions. It is good with ureteroscopy as well, because it fits well with thin probes used in semi-rigid ureteroscopy, minimal risk of damage to nearby tissues, making it suitable for complex cases, for example, in pregnancy. And stone migration is a significant drawback in it, especially in larger and proximal stones. And randomized trials show that laser lithotripsy is superior than pneumatic lithotripsy. And for bladder stones, pneumatic lithotripsy is very effective in transurethral and percutaneous bladder stone treatments as well, and is highly recommended for large bladder stones. Then comes the ultrasonic lithotripsy. Basically, the electrical current creates sound waves fragmenting stones with mechanical vibrations. Aspiration, and during the process removes the debris. The tissue comparison of Olympus ultrasonic lithotripsy with the electrohydraulic, pneumatic, and holmium laser lithotripsy showed no uteral or bladder, because basically there is a risk of epithelial layers which were stripped through the. It was a major drawback of this specific energy, that epithelial layers were stripped, and edema was observed in ultrasonic lithotripsy. Then comes the laser lithotripsy. Ruby laser was initially used in 1978, and then after that, the holmium is widely used now in transurethral and percutaneous stone removal due to safety and easy of use, especially for small to medium stones. It faces the challenges with larger stones, because larger stones create excessive stone dust, reducing visibility and increasing operation time. So combination techniques are used when we face larger stones. For example, laser is combined with ultrasonic, and suction improves stone removal efficiency, especially for stones of over 4 centimeters. And now the techniques are used, and advanced tools are there to enhance the visibility, drainage, and stone detection, improving procedure time and outcomes. So here we will discuss the holmium laser versus erbium laser. The mechanism of holmium laser is primarily uses a photothermal mechanism, where the light energy is absorbed by the stone surface, leading to a temperature increase and causes fragmentation. Basically होता है कि holmium से जब हम एक stone को target करते हैं, तो the light gets absorbed and it heats up the stone, and it causes it to break down. Moses's effect occurs when a rapid vaporization of the fluid creates a vapor channel between the fiber tip and stone surface, allowing a more direct energy transfer. So this is a video of Moses's effect. Sorry. So as you can see that this is Moses's effect, that there is a water bubble जो है ना वो vapor bubble form होता है, और then it travels through the medium and then causes that effect on that. This is called the Moses effect. Okay, so IBM laser, it combines photothermal as well as photoacoustic mechanisms, producing both heat and stronger shock waves for efficient stone fragmentation. The wavelength and absorption, holmium laser produces a wavelength of 2100 nanometer, which is less efficient in photothermal absorption, while the IBM laser has a wavelength of 2940 nanometer with 5-fold higher photothermal absorption, allowing for deeper craters and more effective for stone removal. Fragmentation size produces fine. Holmium laser produces fine fragments due to its photothermal process, while IBM laser tends to create larger fragments initially, but can still generate small particles similar to holmium for clinical purposes. Soft tissue penetration, as we discussed, holmium has 0.5 to 1 millimeter penetration, and IBM is even shallower, and there is a depth of 7.79 micrometer, making it safer for use around delicate tissues. Uretoscopy and laser, holmium laser, YAG laser, lithotripsy, and the silica fibers are thin, flexible, and durable, and possess transmission efficiencies. Basically, the delivery systems that we were talking about. So these hydroxy silica fibers are the delivery systems which make holmium more efficient, because these fibers are durable, flexible, and possess transmission efficiencies, allowing for effective photothermal stone fragmentation. अब इसमें ये फाइबर स्पेसिफिकेशंस है कि फ्लेक्सिबल में जो है वो 200 माइक्रोमीटर फाइबर यूज होते हैं, while semi rigid में 365 micrometers are optimal for upper pole stones. Irrigation needs smaller semi rigid scopes, prefer fibers less than 300 micrometers for effective irrigation. Clinical effective fragmentation techniques में डस्टिंग एक टेक्निक है जो कि हम आगे देखेंगे. Produce small dust side fragments, reduce the need for basket extraction, and energy control. Lower energy is used at high pulse rates, and it minimizes debris formation. So these are the basic two most common fragmentation techniques. One is the popcorning effect. It involves the positioning the laser fiber in a way that allows the fragments to bounce around within the kidney or ureter, repeatedly striking the laser and breaking it into even smaller pieces. And this action resembles the popcorn popping, so it's known as the popcorning effect. So ये होता है कि जब laser apply की जाती है तो the stone continuously bounces back and forth, जिससे जो है वो एक तो वो popcorn की तरह लगता है, and then when it is bouncing, तो different angles से जो है ना वो उसको जब laser strike होती है तो different side से जो है stone breakage होती है. While the dusting effect, it is a more controlled approach. The laser energy is adjusted to gradually reduce the stone into fine particles or dust that can be naturally flushed out through the urine. Then there are dual modality lithotripters, in which basically it uses two modalities. For example, the lithoclass ultra, it combines ultrasonic and pneumatic technology for effective kidney stone fragmentation, and it is designed for precision and efficiency, allows customizable settings and continuous suctions to optimize the stone removal. Then there is cyberband, which uses ultrasonic lithotripsy, and then there is shock pulse, which uses a dual action, the lithotripsy, that uses ultrasonic energy as well as the ballistic shock wave energy for efficient stone fragment. अब इसमें आप तस्वीर में देख सकते हैं कि there are basically two. One is the ultrasonic probe, and the pneumatic probe is also in that device. So it performs dual action. Where अगर जो है वहाँ पे ultrasonic की use होगी, need होगी, तो we can press the button for the ultrasonic probe, and as well as the pneumatic effect is also there. So that's the presentation. Thank you.